In this module, I wanted to shed some light on preparations for leaving the hospital. Prior to discharge, you really should have a pretty good level of comfort with just about everything, and that includes medications, how to take them, why you're taking them, potential side effects, and what to watch for. How to care for your wounds, how to get around safely without using your arms to get up, and how to navigate steps safely, when to follow up with your primary doctor, your cardiologist, and your surgeon, and what sort of signs and symptoms and feelings and physical sensations should you worry about. This is a picture of my room, nothing fancy, as I'm preparing on the final day to leave. There is a checklist that you can download. I encourage you to do so. It'll give you some specific questions to ask prior to leaving the hospital. Make sure that you can answer all of them on the list. Take notes. A few points of importance. Make sure that you can enter and exit both sides of the bed. This is critical. I learned a few days into my hospital stay that I had a hard time getting out of the left side of the bed, which is the side that I would be using primarily at home. And so getting some additional help and support and mastering that technique was quite important. The goal oftentimes prior to leaving the hospital is independent self-care. The nurses want to make sure that you are comfortable doing your daily needs, daily cares, getting up and around safely. They don't want you to fall and injure yourself, and their overriding goal is your safety. Keep in mind the home environment, whether you have stairs to navigate, how high is the bed, are you using a tub versus a shower? These are all things that can be addressed prior to discharge from the hospital. This is a picture of myself just a few hours prior to discharge, freshly showered, incisions are intact and dry, just waiting for my IVs out, to get my IVs out and to roll on down the hospital out the front door. Two of my favorite nurses, Patty and Anna, provided wonderful care. And a few points to bring up when you're leaving the hospital, particularly if you're traveling by car. You want to have some extra pillows to support your head, your heart pillow for coughing and deep breathing, and unfortunately some sneezing or whatever else goes on in the car ride home. Potentially some extra blankets. I had a significant difficulty regulating my temperature, and despite the outside weather being in the mid-60s, I was freezing cold despite a coat. And so just keep that in mind. It's important to stop every couple hours to prevent blood clots. You may have been issued some compression socks to prevent blood clots and swelling in your legs. You can also pump your calves, flex and extend your ankles, and this can help with the prevention of blood stagnating in the legs and developing blood clots. I want to just take a special moment to thank my surgical team and Mayo for an amazing experience. This is Bob, the surgical PA, and I'm dressed, ready to go in just moments from leaving. If you go through the downloadable checklist, I'm confident that you'll be ready for discharge, and I wish you the best in a speedy recovery.